My name is Celia Escalon, but you can call me Ceci, and I'm a clinical assistant. But the reason why I joined Blue Circle Health is because helping others is a significant part of my own personal values, and I'm very excited to work with an organization that shares that. I just love working in a company where I know that my work on a day-to-day basis really contributes to the community. Clinical assistant has direct patient care, and most of it takes place through a phone call, what we call a clinical phone call. And that is basically getting the patient ready, getting you ready to go ahead and meet the clinician. It's like if you were going to a doctor, a nurse or medical assistant calls you in, does a little triage, check your vitals, goes over your questions, goes over your meds, and then puts you in a room and you wait for the clinician to see you. So we're trying to have that flow also in a virtual way. We'll be calling you every time you have an appointment with either our endocrinologist or a nurse practitioner. Blue Circle Health wants to empower you, provide you with the tools. So when you're on your own, you know what to do when you don't feel lost. You have achieved something for yourself that you can do for yourself. We become part of your specific type 1 care team, working closely with your existing providers, your existing specialists, keeping them informed of the progress you made in our program. What I like about working for Blue Circle Health is that I get to keep that patient contact. I really like helping people. In my previous job, in-person job as a medical assistant, I had contact with patients, and for a minute I did think like, am I going to lose that working at Blue Circle Health because it's virtual? But to my surprise, I have, I think, even more contact with a patient through the phone, and just listening and not having the pressure of you need to move to the next patient, or being timed and just rushed. The feeling of actually sitting down and listening and just trying to obtain as much information for our clinician and for yourself, because that's really going to help the whole team. Once I document what you have provided to me, that will help the whole team get even a better idea of like who you are, what do you need. So I love the time that I have, that I'm able to get with each patient. I hear a lot of positive feedback. I hear that a lot of patients feel so empowered. I hear patients just sending us messages about how they feel that they understand for the first time what type 1 diabetes is, that they didn't know what it really meant, even if they have lived with it for 20 plus years. And we have patients that they don't know even what DKA is. And they've had DKA and they've been in the hospital for that, but they just don't know because of the lack of education. A lot of our feedback is patients' gratitude about Blue Circle Health educating them and providing them with resources. They feel amazing that they can do things on their own. I do want to add, for our Spanish-speaking patients, we do speak Spanish. Our clinical assistant, one being me, is bilingual. So don't be afraid. Language shouldn't be a barrier when it comes to Spanish-speaking folks, Spanish-speaking people. We're here and we have a great team that we can help you with that.